Hello, I am Dr. Sujit Shanshanwal. I am a consultant dermatologist and medical director at Skin Ama Clinic, Mumbai. Today, I will be talking about certain myths that are there about hair care and common queries that are asked to me by patients frequently. So let's start with few of them. A commonly asked question is, should I brush 100 strokes a day for good hair? Now, 100 strokes would be a bit excessive, but to understand how you should use the strokes and brush your hair, you need to understand what is the purpose of using the brush. Now, when you use a brush and you run it over your scalp through the hair, it stimulates the scalp skin to improve the blood supply to the hair roots. Apart from that, your scalp constantly secretes sebum, which is oil. And when you move the brush from the scalp along the hair length, it helps to coat that sebum onto the hair shaft, thereby offering protection and keeping it coated. So rather than the number of strokes, brushing your hair properly is more important. Now, if somebody has tangling of hair, then they should first start with the later end, with the segment at the later end of the hair length, and clear those to avoid the strangles being present there. Then you move on to a previous segment, brush that, and gently come onto the scalp level, and then brush your hair from the scalp to the length of the hair. So this is how you need to use the strokes. So 100 strokes would not be needed. Even 15 to 20 strokes are fine, but doing it properly is more important. Coming to the next question that is commonly asked, does hair get used to a particular type of shampoo? The job of a shampoo is of a cleansing action. Now, patients often feel that if they're using the same shampoo, it is not working the way it used to before. So that is not because your scalp or your hair have become used to the shampoo. It is just that the requirement has changed. Now, when there is dryness of hair, we need a different milder shampoo to prevent more damage because of the chemicals on the hair shaft. If the scalp has inflammation or flaking, we need to change the shampoo accordingly. So your hair or your scalp does not grow tolerant and become ineffective with the same shampoo, just that the requirements may change. So after assessment, a change may be needed accordingly. Coming to the next question that is commonly asked, does stress cause hair fall? Now, stress can be present in various forms: mental, physical, external, or local around the hair root level. So, these various types of stress can definitely increase your hair shedding. What happens is during times of stress, your root undergoes a preservation mode. And because of that, it stops creating hair and goes into a resting phase to preserve itself so that when the stressor, the trigger has gone, then it can start generating hair again. So because of stress, the preservation mode that the root goes into, the hair loses the attachment and it falls off. So stress can definitely increase hair fall. Next common question is, once hair is lost, does it come back? So the common shedding that happens on a daily basis is a part of the hair cycle. Your hair shedding in your life is never going to be zero. The hair root, it creates hair, it goes through a resting phase, and then it starts creating hair again. So the hair that is lost during the daily routine shedding, those hair do come back. That is not permanent loss. Now coming to medical conditions, there are certain conditions in which the root may be permanently destroyed and it may not come back again. Or in certain conditions where the root has undergone a temporary arrest in the growth phase or weakness, we can make them healthy and stimulate the growth again. So for the medical conditions, a proper assessment and examination is of paramount importance. Next commonly asked question is, should I oil hair every day? How frequently should one use oil? Now the purpose of oil is to protect and provide a coating. Your scalp is one of the most densely packed areas with sebaceous glands, which are the oil secreting glands. So your scalp regularly creates oil or sebum. In patients, if they feel that the scalp is dry, oil can be used, which will help to hydrate the dry surface of the skin. And in patients who have dryness of hair, the oil helps to provide a coating and protect the hair by avoiding dehydration and damage to the hair shaft. So oiling need not be done every day, but yes, it can be done at frequent intervals to keep the hair protected. Next commonly asked question, is dandruff just dry skin? Now the commonly seen dandruff that patients experience, that is basically the layers of skin that are coming out because of the inflammation on the skin surface caused by the dandruff fungus. In some patients where the reactivity may be more aggravated or during dry weather changes, the skin may get more inflamed, so it can flare. So it is not just dry scalp, it is a byproduct of the inflammation happening at the skin level. And depending upon the severity, the intervention varies accordingly. Another myth is, does hair grow faster if I cut it more often? Hair that is outside your scalp skin is dead tissue. If you cut your hair or even if you burn your hair, it's not going to hurt because that is dead tissue which is outside the skin, the hair that is formed. So the live part of the hair is at the root, which is inside the skin surface, and that is from where the hair is generated. So cutting your hair at the outside part of your scalp, which is dead tissue, has no bearing or impact on the rate of growth, the speed of growth, the width of growth happening from the root under the skin surface. Another question is if shampooing every day is bad for hair. Now, the job of a shampoo is to clean your scalp as a cleansing action. So, the shampoo, if it is used too frequently, the regular cleansing can damage the hair shaft and thereby cause roughness of hair. And therefore, if a patient has inflammation in the skin, on the scalp skin, in those cases, we may have to use it more frequently. But if there is no existing medical problem and for routine use, a mild shampoo can be used twice or thrice a week to ensure that the dirt and grease is cleaned off and the hair texture and the health of the skin is maintained intact. So there is no need to use it daily if there is no existing medical condition. The next common question is the effect of hair serum only temporary? For that, you need to understand what is the purpose of a use of hair serum. A hair serum gives a coating action by protecting the hair by creating a coating over it. Now, whenever you wash your hair, that coating will be washed off. So the effect of the hair serum will be temporary and the hair serum would have to be applied to coat the hair and protect the hair. So the serum is important, even though it's temporary, to maintain the integrity of the hair shaft and the hair length. You need to use a serum to keep the hair well protected. Another common query that patients have is genetic hair loss reversible? The most common cause of genetic hair loss is androgenetic alopecia. So apart from the genetic component, it also has an andro component, which refers to the influence of hormone on the hair roots, thereby making them thinner and damaging them over time. Now, we cannot change the genetic structure of a person, but we can intervene in this hormonal influence which is happening on the roots and thereby make the existing roots healthier and improve their health and make them thicker again. Over the course of the progression of androgenetic alopecia, some roots which are permanently destroyed, they cannot be brought back with medical therapy. That is where we need to go for hair transplant to replace the lost roots. But the damage that is ongoing for the hair that are still present can definitely be reversed and we can get an improvement in those hair.